So for the Glasgow coma scale, you have three things you're assessing. You're assessing the eyes, the patient's verbal response, and the patient's motor response. For the eyes, you have 4 points that you could possibly get. 4 being a spontaneous open, so when you walk in the room of a patient, they would open their eyes. 3 being to a loud voice. You introduce yourself, they don't respond, so you speak a little bit louder, and they're able to open their eyes. 2 would be to pain, so you would pinch the fingertip of the patient, and then they would open their eyes to that. And then 1 would be no response. For the verbal response, you have oriented, which they know where they're at, they know the time of day, they're alert and oriented. For 4, you would have they understand your question, but they're confused at where they're at. Say they're in the hospital, but they think they're at home or in the grocery store. 3 would be inappropriate words. So you ask them a question and they speak out random words that don't apply to anything that you asked. 2 would be just incomprehensible sounds, where it's just a mumble of some sorts, and then 1 would be no response at all. For the motor, you have the patient is a 6. The patient is able to follow commands, squeeze your hand, stick out their tongue, whatever you ask them to do, they're able to follow the commands and do it. 5 would be you would pinch their upper trap or another place on their body, and they would be able to localize the pain, so they would reach up and stop you from pinching their upper trap. 4 would be they withdraw to the pain, so you pinch their trap and they move out of the way. 3 would be abnormal flexion response, so again you pinch their trap and they flex their limb. And 2 would be an abnormal extension response, so like the flexion, but now they extend their limb. And then 1 would be no response.
All right, so I'm going to assess a patient through a Glasgow coma scale. And so here's my patient. Hi Jenna, I'm Kevin. I'll be your student physical therapist today. Jenna, are you there? Okay, perfect. All right, so do you know where you're at right now?
I'm at the grocery store.
Okay. And then, can you shake my hand and squeeze my hand for me? Good. Now can you blink your eyes twice? Perfect. So based on that assessment, she didn't open her eyes spontaneously. She only opened it to the touch of pain on her fingertip. That would be a 2. She was confused when she understood my question, but she was confused when answering it. That would be a 4. And then she was able to follow both of my commands. Normally I would do a stick her tongue out. Because of COVID protocols, I just had her blink her eyes twice, and she did that as well.
Based on my patient's reaction, I would give her a score of a 12 on the Glasgow coma scale.